back to our Watch Before Surgery series. In this video, you're going to see a patient talk about the importance of exactly what you're doing right now, watching other patients talk about their experience and the importance of doing plenty of research before making your decision. It's also important to know what to expect before surgery.
I would like to ask your permission to use this video for educational purpose on the internet.
Yes.
Let me first turn around and say you had a grade 2 spondylolisthesis of the lumbar spine, and it seemed when you had a previous surgery before, but then about a month ago we went and did a 2-level OLIF procedure to fix your spondylolisthesis. This is by any standard a quite significant surgery. Why don't you start telling me first your symptoms before the surgery?
Symptoms before the surgery were consistent lower back pain on the right side prominently, some generating down the right thigh, and yeah, it was just constant.
Okay. And 1 to 10, how bad was that pain and how long did you have it?
That pain was getting consistently worse through activities that I was doing, and from 2007 when I had my first back surgery, with the spinal stenosis and everything else that was going on, it was just, kind of degenerating right along.
Yeah.
So
1 to 10, how bad was the surgery just before our surgery?
How bad was the pain?
Yeah.
The pain was probably at that 9, sometimes
9,
even
so
10.
really severe.
Yeah, it was.
Yeah. Now, you got a laminectomy many years ago. And
Yep.
obviously in a laminectomy, we remove the back of the bone. So that bone is there for a reason. When we remove it, sometimes we make a weak spine even weaker. And obviously your spondylolisthesis got really worse.
Yes.
Now, but sometimes if the compared laminectomy to open old-fashioned surgery, laminectomy is faster than open old-fashioned surgery. So for that reason, many surgeons decide to do that rather than a more definitive fusion for your spondylolisthesis. Now, did you look into your option after before you met me? And
I knew kind of what the options were and stuff.
yeah,
And
what did you find out about?
well,
the options?
I had found out that, of course, with the L4, L5 disc decompression back in 2007, that did take away my numbing foot that had been there for a year and a half. But then when this procedure, I had done some research on that, it was less evasive, and it looked like it was probably going to work for me, because I had tried a lot of over-the-counter medications, I had tried topicals,
it wasn't
anything.
livable.
Yeah, and physical therapy and traction, all that stuff. It wasn't getting better.
Yeah, and before the surgery, we talked about the surgery, how it's done, and what are risk versus benefit. And you had many of those kind of expectations that we have in certain number of people that things can go on the way of getting better. And so let's start with that. The surgery was done about a month ago, correct?
Correct.
How long did you stay in the hospital?
I was not in the hospital. It was an outpatient procedure.
Okay.
My daughter drove me down, and it was a 2-hour drive, so that was a little bit, difficult. And yeah, the first 2 weeks, I would say, probably were the toughest, just because there was, just a lot of pain in the back there and
Let's
everything.
start with your drive back, actually, right after the surgery. So how many hours after surgery did you drive back?
We drove back, I believe it was soon after
few hours
after, and it was about 2.5 hour drive back to my hometown. My daughter did stay with me, which was nice because she was able to monitor everything. But yeah, it was just kind of slow moving for the first couple of weeks.
The ride back was a little rough?
Yeah, the ride back was a little rough.
Yeah.
We did get out, so I could stand up and move around, but
traveling
is a little difficult.
Yeah, in a situation like that, we said to obviously put the brace on.
The brace was on.
Put the back of the seat down.
Yep.
And literally, drive more carefully.
Right.
And every hour or so, get out of the car, stretch your leg, walk for a few minutes, and then continue every hour. But it still is a rough thing, right?
Oh yeah, it is a rough thing, but I was able to, after that first couple weeks of getting my routine down at home, able to do some of the pre-op exercises from physical therapy, which kind of helped me with some of the pain
Yeah.
afterwards.
Now, the pain after this, before the surgery, you said your pain was 9 in the back.
Yeah.
How is that pain now?
The pain now is probably on, on certain days it'll be a 7.
With certain activities?
Yeah, with
But
certain
generally,
activities,
how
but
about-
generally maybe about half of what it was.
What it was.
5 or 6.
And this is exactly what we call this expectation management video, meaning that a month after the surgery, pain going from 9 to 5 to 7 is normal.
Yeah.
This is what we expect. Did you have pain in the legs before the surgery?
I had some pain in my right thigh from before the surgery.
How is that pain
Now
in the right side?
it's not really noticeable.
That's gone.
That it's gone.
And that is as well something we usually hear, that if you have a pain before the surgery, after the surgery, often, not all the time, but often that goes away. Actually, it's many of my patients telling me right after the surgery, when did your pain in the leg, the right leg, go away?
I would say I noticed it probably a couple weeks ago, maybe.
Yeah, that it's
It
gone,
had to take
huh?
that first initial healing
Yeah.
process to kind of figure out
Notice
what
it.
was from the surgery and what was from the actual, benefits of the surgery.
And then as well, the reason I'm taking this video, because you're exactly the average of what we expect. In a
I like
situation
average.
that. Yeah, average is good. So that meaning the pain in the back from 10 goes to half of it
Yep.
within a month. The pain that you had in your legs gets significantly better. But as well that you said the first 2 weeks were rough. What was rough about it? Because that is as well normal. And
Yep.
I need my patient to hear that you cannot go over this surgery, even though this is the gentlest surgery people can get.
Right.
It's still a surgery. So
Right.
how was the first?
And
few
I
weeks?
think because too I am getting older, that probably played a role in it. I'm almost 60, but I had on the left side, which I had no pain really before, from the muscle being moved. Any type of standing or walking or trying to do anything for more than 10 seconds put me down on the couch, because I had to get that area kind of loosened up and exercised and the pain medication. And then sleeping was a little difficult at first too. But there again, it subsided. So.
Yeah. No, it's actually good observation from the left side, because we choose the left side to go obliquely from almost flank to pass through the muscle to put those cages, those spacers in. These are the spacers that we put in here and here, these two. And that is actually, we go from the left side and you feel the path that we go, even though it's a tube, you still feel that. Now, and the good news for you is that we don't kill the muscle, we don't destroy them, meaning that dead tissue cause no pain because they are dead.
Right.
But they never let you recover from that. Our tissue are alive. So initially they complain. That is what you felt the first few weeks. But as you said, it gets better.
Yep, there's a little bit of numbness still left in the left toe and a couple of the other ones, but
So
that is actually...
talk about the toe.
Okay, so what I noticed is as this is starting to heal, I didn't have any pain going down this side at all
Before the surgery.
But now I have, and it's getting better even as, a month later. But my big toe and a couple of the other ones right next to it, they were they're like tingly numb. And it is getting better though throughout as the weeks go on, because I can feel them kind of waking up again.
Many of our patients as well tell us even first they have from the thigh all the way down to the toes, but then every week they feel more that most of the problem in the thigh goes away, then the calf goes away.
Mine jumped right to the toes.
Yeah.
I didn't have, I had knee surgery a couple months ago, but that didn't really affect it. But mine jumped right from that muscle there down into
down
my
to the
feet.
toes, yeah.
So.
But some patients as well, it goes gradually down.
Yep.
And they as well, and you're exactly average here too, because, as a matter of fact, we say that symptom you describe, about 15% of the people get it. Most of people actually don't get it, but when they have it, they describe it exactly average.
And I was prepared for that, because I seen a previous video that from another patient of yours that had the same. She was a younger girl, but she had the same as I did, and I knew that was probably coming.
Yeah, and that is why I put them out there, not to just tap myself on the shoulder. I put these results that are not my best results, because that is what you can expect. Now, before the feeling come back, some people even have pain there. Thank God your pain is not the main thing, it's just the numbness and tingling. But some people even have pain. But before it starts getting better, you may feel like a jolt, like a throbbing thing, like a electricity zapping going down there. It's no different than when you sleep on your shoulder and your arm goes numb. At first it's limp.
Yep.
Then you feel that like a zingers going down the fingers. That is when the nerves are waking up. So meaning if you start getting like a small little jolt going to the big toe, that is a good sign.
Yep.
That is a sign of healing.
Yep.
Another thing that many of my patients telling me that, in the surgery, I numb everything, I give them medication, is that when they go home, 3 to 7 days after the surgery, they have a peak pain. Did you notice anything like that? That, that especially, about a week after the surgery, actually.
Yeah, I would say about 7 days after the surgery, that was probably my peak, because then I started having problems sleeping, and the pain was just a little bit more to deal with. But, I made myself, do the ice and the heat and the ice and the heat. And took my medication as prescribed. And so.
And let's talk about the medication. First of all, the reason for that is multiple things that make the pain get worse about 3 to 7 days after the surgery. First of all, tissue swelling, it gets worse. Second, patient go home and start doing things at home that they want to do. The activity increases, but as well the medication I put in wears off in that time frame. So that's exactly average and normal what I expect after that. And again, it comes back to that because in our surgery, we cause only minor damage, like if we compare it to burn, like there are multiple degree of burn, like the grade 1 is just very superficial, but it's the most painful because all the nerves are alive and they are shooting signals. Whereas grade 3 burn, where all the skin and the nerves are dead, it's painless. Sometimes open surgery, where it kills the muscle, kills the nerve, initially is less painful, but then it lasts for years. But whereas our surgery, it's initially, if we are not anticipating that and treating that properly, it can be more painful. But then down the road, people recover all so much better. So we gave you multiple medication. We gave you a muscle relaxant and we gave you hydroxyzine or Visceral. That is a medication that usually people take for anxiety, but we know it helps people to just calm down and relax more. But then we gave you as well some narcotic. How long did you take narcotic after the surgery?
The narcotics, I did take them all as prescribed. I didn't do any refills. It was about the 2 weeks worth. And then I kind of went back to the Tylenol and just did that like 2 tablets 4 times a day. So I had 4,000 milligrams because I don't like taking pills in the first place, but I kept the pain medication in my system just so I knew it was, because the pain was going to continue.
And, this is one of those surgeries that, at the beginning, you should not hold back on pain medication.
No.
And, actually, you are below the average because most of our patients, they take a pain medication for a month. You took it only for 2 weeks.
2 weeks.
So we say that the hydroxyzine and muscle relaxant, either Flexeril or Robaxin scheduled, but then other pain medication, narcotic, as needed. So in that regard, we are pretty good.
Yeah. And I've dealt with a lot of pain in my life, whether it was, like the physical pain of it. So sometimes, people can tolerate more than others too, the pain. But that's why it was nice just to be off that medication because there's a lot of side effects too that can come about with that. So
let's talk about your brace.
Yes.
How did you use it and how did it help you?
Oh my gosh, this brace has been great because for driving and stuff too, it just gives the back extra support. It feels good when I try to go do a little bit of walking and stuff. It feels like my back is just, getting more support and getting stronger, which I'm hoping, continues on throughout the rest of this next year. But yeah, this has been a really, really good thing to have. So, and I know I can't be on it forever, so I'll be weaning myself off of it.
We say 4 weeks when you ambulate and 4 months when you're in a car.
Yes.
When because of those vibrations. There is another thing that our patient need to know. You had lots of oozing from your wound. In a regular surgery, literally we put a drain and suck all of that out, meaning skin is clean, but you bleed a lot more. But in our surgery, we don't put any drain, and sometimes it just it bleeds through the those small little incision that you put Steri-Strip on, and then it soaks the. Tell me what happened there.
So the night that we had gotten home after the old outpatient OLIF procedure, I was laying on the couch and I had gotten up and I had noticed the blanket that I was on had blood on it. So my daughter looked at my packing material on the back and it was over 60% saturated with blood. And of course I was moving around, but then the ride home, which probably irritated it, she was able to compress it, put a new clean dressing on, and then we were able to get an appointment the next day at my primary care and made sure that nothing was infected and everything looked good, which it did. But yeah, it was one of those things that did happen. So
and that is as well often normal because we don't put a drain, and sometimes it oozes out. Many times it doesn't, but if it does, it is normal.
Oh, okay.
Another thing that's normal is that sometimes the blood doesn't come out of skin, but then stay under the skin, and the skin looks bruised. Tell me about that. Did you have some of that too?
I had none of. Well, I had some bruising in the back, and I don't know if that was from any blood, accumulating there, or if it was just from the procedure itself. But it's gotten much better.
Yeah, most of the time, if it doesn't bleed out, it looks bruised, and when it bruises, the blood can even sink. Even you can have bruised buttock.
Oh, yeah, no, mine was actually good and stuff. The only bruise I had was just in where the incisions were going in,
and
so.
all of that is normal.
Yep.
So it heals usually well. Actually, we just looked at it. It looked pretty good now. Okay?
Yep.
Now, is there anything else you want people in your situation in the future get? What do you want them to know otherwise?
I would say that do their research, talk to their doctors, have an open communication. I wish this surgery had been around earlier because family members of mine too would have benefited from that. But I'm glad I was able to be able to have it. And now I'm just going to make sure that my back is my number one priority and it gets better.
Now, this comes to that, we talked about all the things that are not perfect with this surgery, like it can ooze, you can have pain, at first it can be tough and so on. But we have to put it in the right place. Compare it to open old-fashioned surgery, and you can do that. Talk about, your first surgery and other surgeries that of other people have gotten open surgery. You say you wish it was there before. What makes you say that?
Well, the first surgery that I had back in 2007, I knew that some of the bone was coming out, but I didn't really realize it until the office up here had done CT scans, so I could actually see where the bone was cut away. Then it made sense that your spine is gonna be compromised if you have bone taken away from it all the time. So I didn't want that. And like I said, family members had gone through that, and how
was their recovery comparing to yours?
Their recovery, it was never full recoveries, and some family members ended up getting spinal fusion. The kind they got, I'm not sure, but I know my dad, in fact, he ended up at the very end with a spinal stimulator because he had so many back surgeries that took bone away. So he had nothing that stabilized his back. So that's why I was really excited when I seen and heard about this procedure, because I'm like, this is not going to take any more bone away, because the more you do that, the more unstable your back gets. So I was happy.
And this is, if you remember, we had this conversation. I told you most of my patients walk within hours after the surgery. They go within 24 hours after surgery home. Within 2 to 4 weeks are back to their previous life. And within 4 to 6 months, the bone grows back and we lift up the limitation. Open old-fashioned surgery, double, triple, quadruple those numbers. Within those things that we just talked about, I think from what you described, you're right on the path. And any other question or comment?
No, I'm very pleased, and like I said, I got over that initial couple weeks where it was a little bit hard, but it's worth it if your back is gonna, you gotta take care of your body.
Well, thank you so much. I appreciate that.